Good afternoon, everyone. I'm Rita Bhalla from Indian Cancer Society, and today I'll talk about the human papilloma virus, the HPV vaccine, and what makes the immunization policy so very important, especially in a country like ours. So what does HPV have to do with cancer? Well, persistent HPV infection is the root cause of most cervical cancers. Most women's immune system is so strong that she can fight this, the infection spontaneously. But in a few section of women, the infection would persist, and it could cause precancerous changes in her cells. HPV 16 and 18 are found to be most commonly associated with cervical cancer. Worldwide, cervical cancer is the fourth most frequent cancer in women, and it has 6 lakh new cases every year with 3.5 lakh deaths. So that's more than half the number of women who lose their life because they have not been detected on time. So this is truly very, very tragic because it's a very slow-growing cancer, and it has a uniquely long pre-invasive phase of maybe 10 to 15 years. So in this long period, a woman can easily be detected, her cancer can be detected, and she can also be treated in this time frame. So have we failed our girls and women? The main problem, I think, is ignorance. Women do not take the signs and symptoms of this disease seriously. They just wish it away. They don't even go to the doctor that I have this problem. And about the screening, they just have no idea. Most of them have not even heard of pap smear. Now, what to talk about pap smear? They have not even know about cervix. Most of them don't even know where the cervix is. When we talk about the uterine cervix, many educated girls and women will think that we are talking about the spine. So we explain to them that no, here we are talking, spine means neck, but here we are talking about the neck of the womb. So ignorance is surely not a bliss in this case. Also, there's so much of stigma attached to this cancer, as people feel, oh, that kind of women get this cancer. What does that kind of woman mean? Women with multiple sex partners. But most men and women will get this infection at some point in time. Women are unfortunately conditioned to believe that it's very, very shameful to have any kind of gynae problem. HPV is a gender-neutral virus, and it is sexually transmitted. So can women get it on their own? No, no way. Now, rural and economically disadvantaged are the most affected by this cancer because of poor access to healthcare and also to the treatment. So the scenario of cervical cancer prevention is completely different in the developing and the developed world. In India, over 80% of the cervical infections and the high-grade pre-malignant tumors, nearly 63% of those are connected to HPV 16 and 18. And this is much more than the global average. India's contribution to cervical cancer is over 25%, and to the mortality is more than 26%. So it's a really sad state of affairs. The burden of cervical cancer is so large that the general belief is that it is the only cancer that's caused by HPV. Well, HPV is a virus of the skin and can infect almost all human skin surfaces and cause cancer in most of the sites that it affects. A myth that needs to be debunked is that sexual intercourse is a must for transmission. The truth is that it does not require penetrative sex. It can be transmitted through intimate touch. HPV 16 causes nearly 85% of all anal cancers. HPV 16 and 18 have been found to cause close to half of the vaginal, vulvar, and penile cancers. And HPV causes oral cancers and cancers of the throat and the neck. So now let's talk about the global strategy. According to a research last year by the World Health Organization and the studies by the International Agency for Research on Cancer, a single dose of HPV vaccine effectively prevents cervical cancer in women. The ability to protect against so many cancer-causing HPV infections with just one vaccine instead of the usual 2 or 3 doses would make a big difference in preventing the large number of cervical cancers that are happening worldwide. Single dose would make it logistically much easier and less expensive to administer. The infrastructure needed to administer multiple doses, it also includes tracking when each person received the first dose. This is a significant barrier to achieving widespread vaccination. So a vaccine where you just give one dose and they are done with is a much simpler approach. With global vaccine strategy scenario, needing just one dose would allow many more people to be vaccinated. In 2018, the World Health Organization organized a global call for action to eliminate cervical cancer, calling for all the stakeholders to unite together in this common goal. In August 2020, the World Health Assembly adopted the global strategy of cervical cancer elimination. Now, to eliminate cancer, all countries must reach an incidence rate of below 4 plus per 100,000 women. Achieving this goal rests on 3 key pillars and their corresponding targets. So every country should meet the 90-70-90 targets by 2030. Each country has to depend on these 3 strong pillars to eliminate cervical cancer. Now, what are these? These are vaccination, screening, and treatment. So first of all, vaccination. 90% of all the girl population must receive the HPV vaccine before they turn 15. Screening of 70% of women must be screened and using only high-performance tests by the age of 35 and again repeated before they turn 45. Treatment, 90% of the women should be treated if they have precancerous conditions. And if the woman has invasive cancer, then she should receive the appropriate management for it. On November 17th, 2020, we made history together. The world glowed teal for cervical cancer elimination. For the first ever, 194 countries resolved to eliminate cancer. Despite the pandemic, the world united to launch a movement with global strategy to eliminate cervical cancer. Across the planet, communities illuminated 100 landmarks in color teal to celebrate the historic movement and spread the message that everyone can contribute, every community matters, and every country can eliminate this cancer. The end was finally in sight. Now, HPV vaccine targets the HPV types that most commonly cause cervical cancer. So HPV vaccine provides primary prevention. So that's how important it is. The advent of HPV vaccine has advanced the hopes that eradication of cervical carcinoma might be possible. It makes us believe that it's the beginning of the end of cervical cancer. HPV vaccine is most effective between 9 to 12 years. Why? Because the preteens have a higher immune response to HPV vaccination than the older women. Teens should be vaccinated regardless their sexual activity, because we have seen that many times the sexual debut is earlier than the legal age of marriage, that's 18 years. So in order to ensure that the recipients receive maximum protection,
The target population should be adolescents between the age of 9 to 13, who are supposed to be sexually inactive and who have a better immune response. It works best if boys and girls get it before they come in contact with HPV. In other words, before they become sexually active. Rather, even before curiosity and sexual or genital touch begins. Though it was earlier approved for women from age 9 to 26, these days women up to 45 are being vaccinated. So it's better late than never. Girls generally from the age of 9 to 14 were given 2 doses with a gap of 6 to 12 months. Girls aged 15 to 26 were given 3 doses. The second dose was generally after 1 or 2 months of the first dose, and then the third one 6 months later. Adults aged 26 to 45 could also get vaccinated now, but they must consult the doctor first. It would, of course, provide little less benefits because more people would have already been exposed to this virus. Now, boys can't get cervical cancer, but they can transmit HPV. So vaccinated boys would reduce the HPV circulating in the population. So it can protect females from cervical cancer by decreasing the chances of transmission of HPV since it's sexually transmitted. When percentage of girls getting vaccinated reaches about in the range of 30 to 40%, that's the time when vaccinating boys is suggested to have a substantial enhancing impact on trying to protect those girls who have not been vaccinated. The vaccine, of course, would protect older women and men also, and it would also expedite the reaching zero goal. So like all vaccines, HPV vaccine is a preventive medication. It cannot cure the disease. The vaccine can prevent an infection, but it cannot clear it once it's already happened. Also, it's not effective against all the oncogenic HPV types. So regular screening would still be required, though the frequency may be quite low. Now, earlier the vaccination was deemed to be not affordable because it was so expensive. Only the richer countries could plan to have a nationwide program, like Australia did it way back in 2007. But now, the Serum Institute of India has launched the first homemade HPV vaccine, which is affordable with the price likely to be around 200 to 400 rupees. It would be rolled out in high capacity to overcome the existing market shortage. Thus, India could lead in the vaccine development, take care of the national requirement, and maybe eventually help out other nations also. So COVID-19 pandemic awakened India to the importance of preventive healthcare. Licensing of the Indian vaccine last year finally gave us an affordable HPV vaccine. So now, is India ready to eliminate cervical cancer? If all the 3 pillars of elimination are established, India could eliminate cervical cancer by the year 2063 and half the mortality rates by 2036. At incidence of 18 per 100,000, India is well above the target of WHO, which is 4 per 100,000 women. So cervical cancer doesn't find a ready mention in our country, even though it kills 1 woman every 8 minutes. And we have effective tools to prevent it also. So the question again is, are we failing our girls and women? The HPV vaccine is very helpful in the prevention and elimination of cervical cancer. With it becoming more accessible and cost-effective, the campaign for cervical cancer prevention will definitely be very, very effective. The only thing that we need is awareness. Now, communication is the best way to reduce the hesitancy that people have. And we should so raise the awareness and influence the people into making a good choice of getting their daughters vaccinated. Making parents and caregivers aware of the cancer vaccine that's why very, very important. We need to reach out to parents before we speak about it to the girls. It's very important to give out a clear, positive, and simple to understand message about the importance of this vaccine. There are certain social, cultural issues associated with HPV vaccine because it targets sexually transmitted infection. Moreover, it primarily targets female adolescents and young women. So parental awareness and attitude towards the vaccine is likely to be the major determinant for the acceptability. Some parents are of the view that why should their daughters be getting this vaccine when they are not even socially active? So a robust communication strategy is very much required to ensure that they are convinced of the benefits of the vaccine and all their concerns are addressed. Prioritizing the cancer prevention rather than focusing on the infection can encourage parents to think about their children's well-being in the long run. It is necessary to break the bias, reduce vaccine hesitancy, and encourage the community to accept the HPV vaccine. Media workshops should be held to sensitize the press towards this program to ensure that false information regarding adverse effects does not spread. The classic example is the vaccination in Telangana way back in 2009. So the cervical cancer elimination program is likely to be a part of the government's immunization policy. This is very, very important as it makes it easier and to be completely successful. Delhi State Cancer Institute had started providing the vaccine way back in 2016, and that also free of cost. And the program had really become very popular and successful by 2018. But during the pandemic, the turnout was very low, and so 8,000 precious vaccines were lost. So that's why it's very important to have a good government immunization policy to avoid such setbacks. Government initiatives such as Ayushman Bharat have put the country in a position to enjoy what was once thought to be the luxury of preventive health care. The center has written to all the states and union territories to create awareness on the prevention of cancer and the importance of HPV vaccine among girl students across the country. HPV vaccine for girls aged 9 to 14 will be provided primarily through schools free of cost. HPV vaccine is of public health importance. The schools which have an on-site vaccination program and a community-based education system would have higher turnout for the vaccination. Parents, guardians, and school staff need to be educated well before the vaccine is offered to them. This could include health information, warnings about tobacco use, sex education, which should be tailored to the age and culture, condom promotion, male circumcision, and many other things. Even the minor side effects of the vaccine should be discussed, like there may be redness, pain, or swelling in the area. A person may feel dizzy, have a headache, or have some fever or joint pain, but these are only temporary. It could be introduced to the parents as a cervical cancer preventing vaccine rather than a sexually transmitted infection. Community participation is very much required. Each one of us can play a role. Ensure that every girl you know has been vaccinated. We could also request the trusted and credible voices from you, the medical community, to dispel the myths and misconceptions. You're just saying that you must take the vaccine is going to work wonders. We at Indian Cancer Society Delhi have taken the initiative to spread the awareness in all our programs. We can all together make this initiative a huge success and help eliminate cervical cancer from our country. Thank you.
Good afternoon, everyone. I'm Aruna Ummat, volunteer and director training at Indian Cancer Society Delhi branch. While my colleague talked about HPV vaccination, before I start, I will be talking on cervical cancer. Before I start, I must clarify that we volunteers at Indian Cancer Society are not medical experts. We normally talk about the social aspect of various cancers. Now, cervical cancer is the second most common cancer among women and in India, and it is more prevalent in among rural women and uneducated women. But I would rather say that it is not only the cancer of the impoverished, it is the cancer of the unaware. So, you know, why I say so? Because in the case of breast cancer, the woman can feel with her 3 fingers the breast tumor on her breast, or can see the changes in the skin of the breast to find out, you know, early detection. But unfortunately, sadly, as my colleague has also mentioned, that most of us don't even know the position of the cervix in a female body, and it is normally confused with the spinal cervix, which is the neck. So we bear about 1/5 or 1/6 of the global load of cervical cancer. This is just comparing the global scene with the Indian scenario. We have 18.3% cervical cancer cases in 2020 as per the Globocan, whereas the global was only 6.5%. Now, what are the contributing factors of cervical cancer? No organized screening program, and a majority of the Indian women are, you know, lack awareness and also the access to prevention and treatment facilities. Then these are some of the, you know, risk factors, high risk factors for cervical cancer: early marriage, early onset of sexual activity, early pregnancy, high parity, you know, lack of maternal care after the childbirth. All these, they tear the soft tissues. Then crowded homes, hasty and rough sex does the same damage, and therefore the untreated lesions may lead to cancer after a couple of years. Then poor genital hygiene, lack of absence of toilets, that also pose a very high risk for this cancer. And building of toilets now under the government scheme of Swachh Bharat is a very healthy and welcome drive in this direction. Many of the you know, social service organizations have also started spreading awareness about menstrual hygiene and have started distributing sanitary napkins free of cost. As it is already pointed out by most of the panelist doctors also, that stigma in cancer is a psychosocial and you know, intercultural issue, and more so in this cancer. What happens is that any issue related to the private parts of a female are always hushed up. That silences the women, and they never seek any help. That stigma attached the feeling of shame, others' judgment that this cancer can occur to that type of women. It is unclean cancer. All these, they reduce the communication, and the women suffer endlessly, and they do not find any solace and understanding from the family. Then there are certain misconceptions about this cancer. I'll just mention quickly a few of them. The women may say, nobody in our family has this cancer, so how can I have it? It is not true, because it is not genetic in nature. It is not due to faulty inherited genes. It is due to HPV infection. So anybody can have it. Then the second misconception is, most of the people think, oh, we are faithful partners. None of us has any multiple partners, so we do not carry HPV infection. But as earlier also it has been said, that even when there is, all the adults who are sexually active in their lifetime will have, HPV infection, which normally clears on its own. Whether you have, even if when you have one partner, if this HPV infection remains undetected and persistent and it's not treated, then it may lead to cancer. Then in certain communities, there are, where the males are circumcised, they feel that they do not carry HPV infection, so their women will not have this cancer. The fact is that this risk may be reduced, but it cannot be ruled out that these men will not have HPV infection. Now, cervical cancer is of utmost importance in preventing this cervical cancer, because as it has been earlier said, the contraceptive methods, condoms, etc., do not provide complete prevention from the HPV infection, and it needs to be detected early and treated early to save saving the women for getting infected with, leading to cervical cancer. Now, there are various tests for cervical screening. The first two I have mentioned here are visual inspection tests, one with the acetic acid, abbreviated as VIA, visual inspection, with the dilute acetic acid, and the other one is with the Lugol's iodine, abbreviated as VILI. In both these tests, a cotton swab in these two solutions, they can be applied on the cervix, and the exposed area of the cervix is viewed with naked eye under very bright light, source of light. Now, these two tests are very, and in the first one, if the exposed area appears to be white with acetic acid test, then it results in positive infection. And if this, in the second case, with iodine, if it appears brown or black, then it indicates positive results. Both these tests are very cheap and are suited for low-income group countries with large population, and the very little infrastructure is required. No, healthcare worker is really required to take to view this this test in this area. So ASHA workers are also trained to carry out this test in the rural areas. But this test is not very dependable test because it depends on the estimation of a single person, and no documentation is done in these two types of tests. Then we have a pap smear test, which is a cytology test. It is reliable test in the sense that it takes out the smear of the cervical fluid from the cervix and is viewed under the microscope. The sample is sent to the lab for examination, and the findings are documented and well interpreted. So this test finds out any abnormal cell structure from the surface of the cervix. This test is carried out at Indian Cancer Society right from the year 1990. And in our mobile screening camps also, this test is carried out at our detection center also. This pap smear test is carried out. So normally this test must be carried out for consecutive 3 years, and if the test is negative, then one can give a gap of 3 to 5 years, and then again it must be tested for continuous 3 years. It's better to sort of discuss it with the doctor before knowing about the frequency of these tests. Now this, the next one is the most sensitive test, which is called HPV DNA test. It is different from pap smear in the sense that it tests the genetic material of the HPV virus. The DNA or the genetic material is found out by this test, and the sample is taken in the same way from the smear is taken from the walls of the cervix with a brush, and it is, as in the case of pap smear also, in this case also the sample is collected in the same manner. But it has to be co-tested with the pap smear because that finds out the abnormalities in the cell structure. It is more expensive than the pap smear, and if the test is negative, it need not be repeated for the next 5 years. Now, I will not take more than a second to show this slide because that has been dealt with by a colleague. And this is the most preventive method, HPV vaccination, and she has discussed the details about it, and you can take a second to read it. Now I will quickly go through certain slides to show what is the role of Indian Cancer Society in prevention and control of cancer. These are some of them which I'll quickly show one by one. Our trained volunteers go to various places to deliver talks, awareness talks, be it the schools and colleges. That's the one I've shown on the top left. Then to the community, going into the far-flung areas of Delhi and NCR through the narrow lanes where the women are, encouraged to talk about their health problems. And even in those areas, the screening camps, mobile screening camps are held by by the Cancer Society. The one on the right-hand side, the purple image, it's not a awareness talk. It is a unique training program which we carried out last year from 5th to 11th July for 130 university teachers pan-India. It was done in collaboration with Delhi University Khalsa College, and in the second phase, the 130 teachers trained, they are supposed to act as mentors to carry on the student internship program. And I must say that it is going to be an outreach program, and it has really meeting good success, and they are carrying out this second phase internship program already. These are where our mobile camps are held. We hold pre-screening talks. So there, in small groups, we talk to the women and the males about common cancers, and they normally come out with their health problems, and we guide them to the respective doctors who are present at the site to carry out the screening tests. We also give talks on FM radio, 102.6 megahertz, every Friday from 1 p.m. to 1:15 p.m. on various types of cancers. They are normally delivered in Hindi and for the benefit of common men. and common people. And this is the list only shows that in the month of September, we talked about the various types of gynae cancers. Before that, there were different modules prepared and delivered on cervical cancer. But every week we have, some cancer or the other talk on radio. Now, during pandemic, we carried out online webinars on common cancers, the breast cancer, the tobacco-related cancers, and the gynae cancers. We are, doctors like Kanchan Kaur, whom you had seen in the morning, she and various other doctors from Fortis and all, they came in and educated, the audience about the various cancers. And we also shared the experiences of the survivors who talked about their own journey. This is a very interesting, way of educating people, which Indian Cancer Society adopted. In 2018, we developed a M Shakti app, which is, available on Google Play Store for Android telephones. It is both in English and Hindi. And this M Shakti, this Shakti Didi, she talked about the risk factors, the symptoms, and the preventive measures of both breast and cervical cancer. Now we are coming out shortly with a new version of this app, which will be now, developed in 5 different languages, and it will talk also about other cancers, giving other gynae cancers, giving links and more informative. This is a center, Rehabilitation Center of Indian Cancer Society, which is called Prashanti. It is in Chittaranjan Park. And here we have complementary therapies going on for the cancer patients after they have undergone the treatment. The one on the left-hand side you see is called lymphopress to reduce the edema of the arm after the breast surgery. Similar sleeve we have for the leg after the lymph nodes are removed due to cervical cancer. Then we have reflexology going on the right-hand side bottom picture. We have, at this center, there are regular support group meetings are held. Now we have developed a big support group for breast cancer, and we are also now, looking for support groups for cervical cancer or other gynae cancers. Where, the yoga, meditation, laughter therapy, they are carried out for these cancer survivors. And also doctors come to clear any doubts of the cancer patients or the survivors. This center also invites childhood cancer patients, the young children who are unfortunately suffering from cancer or are under treatment. On every Tuesday, they come and have home-cooked meal at this center, and we do some playway activities and craft work, just to, they are learning experiences also, and also boost their morale. This one is a new, effort for developing an e-learning course on Government of India's SWAYAM portal. We developed a number of modules with the help of very well-known doctors from renowned hospitals, which talks about various fundamentals. And within 3 years, we have about 11,000 enrollments already. That's all I wanted to say. Thank you very much for your patient hearing, and you're all waiting for the lunch. So please, all the best. Thank you.